Dr. Mark Vaughan here to ask you some questions instead of you asking me questions for this private Periscope we're doing. I'm going to turn the camera around so I can see what your answers to attend a committee meeting called the Service Excellence Physician, what's it called? CPAC, Service Excellence Physician Advisory Committee. So this is thank you for your hearts. This is a committee of physicians within our Independent Physician Association, or IPA, and this group's purpose is to give advice to the people who run the Independent Physician Association and actually health insurance, opinion about what improves patient satisfaction. So that's why I'm coming to you guys, hi, and welcome everybody who's joining, to ask you, how do we satisfy patients? Hola! So what I mean is, of course, hi, Shannon's here too. We know that you want a competent physician, that goes without saying. But what are the other things that make you satisfied with your visit to the doctor? Now, it may be things like wait times, or that they know your name, or they're familiar with your chart. What are those things that you would like to see improved in medicine, in your interaction with the doctor? Hey, somebody's driving around San Pedro. So if you guys have, maybe you have an experience you'd like to relate, or you have a specific comment about what your thoughts have been in your interactions with the doctor or the doctor's office. It's not just the doctor, anybody in the office, anything about the office. Somebody says wait time. Somebody says respect for an empowered patient. And that is Robert. Tell me more about that. Tell me what that means. Respect for an empowered patient. Stickers and lollipops when you leave. Yes, we got that. A good listener. Enough time to actually spend with the doctor, especially for a physical. A calm doctor. That's a good one. Being thorough and not brushing off patients' concerns. Okay, good. So let me kind of give you some feedback on some of these you've already said. A doctor who follows up. I know as much as many docs. Please respect that. Trust and feel safe. Concern, cutting edge. Misdiagnosing. Okay, well, that misdiagnosing, that would go along with competence in the practice of medicine. We're kind of looking at, well, that's very much a thing for patient satisfaction too, but kind of looking at these other things that have been listed here. Let's see. What are we going to follow up with here? Follow up even by a team. Yes, absolutely. We try to achieve good working teams in medicine. We do live in an age when a doctor is seeing 20 to 30 patients a day. And so for that, it does take a team of support to get everything done that needs to be done. Some of those other comments. Time, yeah, I just said the numbers of patients. Okay, Robert, work with me, partnership. 2 heads better than 1. Okay, all right. Robert, specifically, the reason I'm hesitating here is because of Robert's comments. Robert's got me thinking about some specific encounters. Robert, I believe you have a PhD yourself. Let's see, a doctor who knows his limitations and sends you to the right place. That's from Shannon. Okay, yeah, Robert, you're there. You are absolutely a very educated person, and I would guess, now I don't know if you're actually in the health field, but I think you are in a health-related science. So you are very knowledgeable about certain subjects. I wouldn't expect you to be as knowledgeable in the entirety of the practice of medicine as your physician. That would be unexpected. But what I'm thinking of when you say that is a lot of patients will say things like, I know my body, and they'll disagree with something that we're working off of. And I've had the experience of patients who know their body, and I don't want to come across as not respecting patients knowing their body, because absolutely they're the ones who live with it. They're the ones who know what they're coming to the doctor about. But at the same time, we've had people who have been reading on the internet or have ideas about what's going on, and they don't have the knowledge of a medical doctor, and they'll have this definite idea of what it is, and they'll fit their symptoms into what they've read about or they've already experienced, not having knowledge of what else it could be, all the 99 other things out of 100 that it could be, and that it may actually fit better with. And so I guess I've kind of been burned by that experience with a particular type of patient, and maybe this is true for doctors in general. It makes you less quick to give that to the patient, that assent that, yeah, you do know, you have knowledge too. We can work together to partner to get you better, to get from where we are to where you want to be, to where we have common goals in your health care. And so I don't know if, for sure if this is a universal for doctors, or if I've just had these experiences that jump out of my mind from so many people with Dr. Google. So I'm glad you said what you did, because I trust my private group here on Periscope that I invited to this, and I'm going to really think about that. Being more receptive to technology, oh yeah, and to embrace using it with patients, absolutely. Two-way communication using technology. And along the lines of what I've been talking about with Robert here, also teaming together for when a patient who maybe doesn't have a background in the health sciences, when they do go looking on the internet, helping them with advice for what kind of sites would be helpful rather than harmful. You love it when your doctor emails you. I'm going to take that to the meeting with me. For those of you who joined after I gave the introduction, I'm actually going to a meeting, a physician advisory committee on what they call service excellence, and that's pretty much patient satisfaction. So we're looking here for the things other than patient competence. Somebody says Dr. Google is bad. In just the plain form, Dr. Google, yes. But in all honesty, I will actually use Google in the exam room sometimes when I'm looking something up. But here's the thing. I'm looking at where the results come from. And if it's coming from the American Academy of Family Practice, or if it's coming from the Emergency Medicine Residency Association, or if it's coming from Stanford University Department of Internal Medicine, I'm seeing where the addresses are that these things are from. I'm sorry, I missed that. I think that was Robert, but I missed that last comment there. So that it's from an actual good source, something that's been peer reviewed, or oftentimes it'll be, I'm looking up some kind of standards of care. We have all sorts of standards that are made for us by various bodies. The American Heart Association makes something called the JNC8 that gives guidelines for the care of hypertension and regular testing for it and goals for treatment and recommendations on what medicines to use to treat it. Things like that. That's what I'm looking for when I go to Dr. Google. Something that I already know is there quite often. Or if I don't know the exact name, I'll know that, okay, there's some guideline for this in this specialty, and then I'll find that it's probably that specialty's body, like the American College of Cardiology, or it may be American College of Emergency Physicians, or it may be the American Academy of Family Practice, bodies that I recognize. I go, okay, yeah, that's somebody that's going to know to make a good recommendation or a good line of principles for the treatment of such and such disorder. But to be able to educate patients in how to see those things is something that would be helpful for teaming together for using technology for good, not for evil. You guys, this is really good stuff. I'm going to take your comments, especially Robert's, because that really hit me kind of hard, because I know I've been guilty of not being really good about that. And I thank you for the hearts. I'm going to the meeting, and you guys were helpful. So I hope you like being a part of the private Periscopes. I hate being lectured by every doctor I see. Hi. I'm thinking about that one too, because I don't feel like I lecture enough of all things, which might be really hard to here, having said that you don't like getting the lectures, looking for leadership, not opinions. Leadership, not opinions. Can you give me, before I go, can you give me a little bit more on what leadership, not opinions means? Leadership, not opinions. Looking for leadership, not opinions. So would that be leadership, not opinions? Would that be the physician who takes his own medicine, follows his own advice? Is that what leadership, not opinions would entail? I'm not sure I'm going down the right path on what that means. Anyway, I do need to go to the meeting, but thank you so much. I hope you guys like being a part of the... Oh, here we go. If I see a doctor in urgent care for the flu, I don't want to be told I'm overweight. What can be a cause of prolonged swollen lymph? Yeah, we're not going to answer questions today. Tell me what to do and not opinions. Or not options. Oh! And not options? So you don't want to be presented options? You don't want to know what the options are? Is that, or the opposite? Did I read that backwards? Because it seems like most of the comments on here are from people who want to be a part of the decision-making process, want to be a team with the physician in deciding what's best. And actually that's quite a bit of what's been taught since we left the whole paternalistic background of medicine, that it's not liked by today's patient to be told what to do, but rather to be partnered with, told what the options are, and find out what's consistent with their values. Like medicine may have a side effect of weight gain or loss of libido in the treatment of depression. Tell them, well, there's also this medicine that doesn't have those options, but it may have more trouble with your sleep, and let the patient together with you make a decision which medicine would be better for them. So Tothmo's old school. He'd rather just be told what to do. I have to feel each patient independently. Yeah, I think the old school patient is more the exception nowadays. There are people who feel that way, who just want to know. They just want the doctor to tell them. They trust the doctor's training and knowledge of them as a patient to decide for them. And you know, if that's what the patient wants, I will provide that. I just need to know that, because most patients are the opposite, and I don't know that without having that conversation about what's more consistent with their values. So we'll have to find out. Being open to natural remedies, says Cyfox Media. Yes, okay. I have been open to natural remedies, and over and over and over, every time, not every time, I'm sorry, I shouldn't say every time. Often when I look into them, what we find is in rigorous, well-designed trials that they're just not coming out to either actually be different than a placebo. Otherwise, they've already been captured by the drug companies and capitalized upon. Or the difference is not that great, or they may actually have worse effects than the synthetic medicines. We actually do try to keep things as natural as we can, but also we want things to be as good as they can. And so I'm actually not a good doctor for the people who would prefer to go the all-natural route. I'll say that right up front. One of the things I'll often say when someone's looking for the most natural is that arsenic and cyanide are natural, but not necessarily good. So we do try to work as much as we can within that, but it's limited by what good rigorous study finds is helpful for actually accomplishing the goal. Consider the cost of tests and drugs for the... I am a big proponent of that. In fact, if you guys don't already know about goodrx.com, it's an excellent place to check for the cost of your medicines. I recommend using it in the doctor's office to see how much a medicine costs that they're proposing prescribing for you, to see if that is affordable, and then ask, hey, what are the options that are more affordable? What am I giving up by going with the less expensive medicine? We have got to try to keep medical costs down. So yes, I am your person when it comes to the cost. And for tests also, it's just embarrassing how little knowledge I have as a physician of the tests I'm ordering for my patients. But I do look them up now and then and try to see where the least expensive option is for the patients to go. $995 now. That's just undoable. I am so sorry you got charged that much for a medicine. Actually, the place where I complain the most is eye drops. Eye drops from the eye doctors. Those are the craziest. You know, I have patients who I'm trying my best to save their dollars